Today, health officials warned parents that immunizations were down more than 40% last month in Washington. Pediatricians are now afraid preventable illnesses will put children at even greater risk. KARA 7's Allison Grandy talked to pediatricians about which children are most at risk.
Pediatricians know it's confusing for parents. Early on in the pandemic, they said to stay away unless it was an emergency. But now they say we're past that, and still as many as 80% of children are not going to the doctor.
A lot of families are scared to go into a medical clinic right now.
Dr. Rupen Thakar works at Swedish Pediatrics in Edmonds. He's concerned children aren't coming for well visits and immunizations.
Our fear right now is that we could end up with an outbreak of something like measles or whooping cough or meningitis while we're already in the midst of a pandemic.
According to the Washington State Department of Health, immunizations for children 18 and under were down 30% in March from the previous year and down 42% in April so far.
We really need our children to be vaccinated. We can't let one virus result in fewer children being protected against other very dangerous diseases.
Those diseases are actually even more serious for kids to get and can be more deadly even than coronavirus.
Even though the vast majority of kids are vaccinated, even a small drop in those numbers can really cause vaccine preventable diseases to reoccur.
They're most worried about vaccinations given before age 2, including measles, whooping cough, meningitis, and tetanus, and the boosters that follow before kindergarten and middle school.
The reality is that at this point, vaccine preventable diseases are probably a bigger risk to the health of young kids than COVID itself.
Doctors want parents to know many steps are being taken to make it safer to go see your pediatrician.
Many offices are doing well visits and maybe even infant or newborn visits only in the morning, and then having sick kids come only in the afternoon.
Offices are deep cleaned overnight. Patients don't wait in waiting rooms. They can wait in their cars and are taken right back to exam rooms. Sometimes immunizations can even happen outside in your car.
People really need to get back to accessing that care so that we don't face new health challenges for these children.
They say the best thing parents can do is to call the pediatrician's office and discuss their child's care. They say many things can be handled with video visits and then a quick in-person visit for something like immunizations or tests. Allison Grandy, KARA 7 News.